A couple of years back we did a project working with Mayo Medical Labs here, looking at a novel way of stool collection, and it was based around a new screening assay that had been developed at Mayo for GI cancers. So it was really important that the patients that were going to have this screen were able to collect a stool sample of a certain size and get it into a preservative. And so it was a really unusual project for us because it was very product-based and kind of, an interesting topic that everyone found a little bit intriguing and, for obvious reasons, a little bit disgusting as well. But we recruited a group of staff at the clinic because we didn't have access to patients at that point. And we were really trying to understand the process of people collecting stool samples. And because we wanted to, iterate prototypes really quickly, we built out a set of different kits. And unanimously, when we came back and we brought these groups back together for a focus group in terms of to describe their experience, they all reflected back to us how the design of these kits, because they had so many different kind of elements, instantly prompted them to start to have anxiety around the act because they perceived that this was going to be more arduous, more difficult than it actually was. And so, kind of naively, we had overthought the process completely and we had over-designed. We learned a really valuable lesson about simplicity and about how we can often overthink things. And so the ultimate solution that was most successful was the most basic. It was basically a little wooden stick and a vial. And so but we could never have anticipated that. I think that we really thought that we were contributing. We really thought that we were going to make this act more tolerable to people. And I think what we did was we created a lot more anxiety around it. We ultimately were able to kind of, I think, learn about how design is really about listening to the user. So my name is Lorna Ross, and I embrace failure multiple times a day.